A very good afternoon and welcome to our session on mindfulness-based psychological interventions for a successful IVF journey. We are glad to have Dr. Vijaygeetha among us and to talk about this in detail. And also, if you have any doubts, any queries, just put all of your doubts on the comment sections. Our doctor are there to solve them. Doctor, you have
Thank you. Very good afternoon, everyone. Welcome again for another session of uh, from me, which is a psychological based questions and session from a policy and fertility. Warm welcome. So today is all about um, in one of the ways looking how can we make this IVF journey successful. This would be one common question that pops up among all treatment seeking couples or consulting couples. And sometimes everything can't be just biological. There can be practical implications, or sometimes a life impingement, or there's some obstruction that comes which is actually unplanned or would have been there but not realized. That all bothers or adds more bother to the existing issues, which is it's like a committed journey. It's not a 1 day 2 day visit that the couple would be traveling towards the clinic or the consultant and the tests and the procedures and whatsoever. So in brief, everybody would have this question: what would make my journey successful? So we are trying to find out a relevant answer, but the answer is also lying within each and every one of you, as well as with the psychologists like me. And we are trying to bring down what would be the optimum thing to be done, which is already research based, evidence documented, and we've seen some fruitful results. So that for a newly applying couple, it wouldn't be like, will this even work or not? Do I need to invest in such intervention? What needs to be done? But though the question lies in everybody's head, what are the things that can be made for an IVF journey to be successful? Well, mindfulness based intervention is one of the most successful topics currently in the field of psychology, and it adds in more depth to whatever one does. As the word says, it's mindfulness, and its roots are lying within the practices of Buddhism. And we had a researcher who's been very prominent in bringing down into conceptualizing and bringing into practical awareness. So we will look how a mindfulness activity would lead journey to be very successful. So welcome to the session. To know that, first let's know what an IVF is all about. An IVF is nothing but an in vitro fertilization, which is the abbreviated form for which is happening in the embryology lab. The embryologist would require an egg, which is an oocyte, and a sperm, okay, for which it is taken out from the couple. So, in brief, the treatment seeking couple. So, according to World Health Organization, if any married couple are unable to conceive over a period of a year with interpreted intercourse, that do not using any kind of a barrier, and they have not achieved successful in conception, such couple are now put under the category as infertility. So that's what the definition goes according to World Health Organization, and we go along with the same. Any couple who not necessary for just for an infertility, sometimes they are fertile, but there can be additional reasons that is not making that conception happen. So whatever can they be, the journey is unique, but the goal remains to be the same, that is pregnancy and achieving a conception for that. So towards a parenthood or motherhood, the journey towards that becomes very unique. Let's understand a little bit about the fertility itself. Every month, from the women's side, the ovaries would release a matured egg. So this egg would contact a male sperm, and this meeting happens in a place called fallopian tube within the women's body. and for which the egg travels to the fallopian tube, and then gradually, if it happens to meet with the sperm, and if the sperm was successful enough in entering the egg, which is the fertilization of the egg, the fertilized egg thus becomes a zygote, and that travel into the uterus. When this fertilized mass of cells, when it is arriving the uterus, by the time it is 2 3 4 days, sometimes is also called another term given for this fertilized cells as blastocyst, and it tries to implant in your uterine cavity, and after which, um, 3 4 days, and the women would experience that this is my period state, and the days are skipped. So the process of attaching the blastocyst cultured cells into the uterine cavity itself is called an implantation. And roughly after 2 weeks since then, when the lady sees that that she skipped her periodical days, voila, she's pregnant. But all that sounds so easy is not so simple, at least in a current trend. There would be a couple who've just married or who's very anxious to conceive, or would have had a history of, let's say, already looked into their female reproductive aspects. And so currently, even in this generation, I would see a lot of males coming up and checking up their male fertility aspects. And then there are predispositions, something like a PCOD, identified in a female, where she usually has a bout of irregular periods, or as simple as, or periods associated with crampy or painful periods. Then she happens to visit a gynecologist who would say things would go down fine, and probably after marriage everything would settle down. Among the male, the most curious aspect or the anxious part, what I see is, once they are nearing or heading towards a marriage, they would try to do their assessment. For a male, the immediate assessment is a semen analysis, which he goes through his parameters to check whether all the parameters do fall within the normal range. If not, what needs to be done. So, among this population, when a couple walks into a clinic, let's say we are just married, we wanted to plan, or we've been married for quite a few years, and we've run out of all the options and we've tried our level best, and pregnancy is not happening, are couples who are now coming into the clinic on regular basis. So what happens for a couple who just want to plan a pregnancy? Well, after marriage, it's too new and it is too much sometimes for a couple to take up a new responsibility. So a lot of hormonal test or a scan, or a relevant hormonal blood test would have been advised. And more or less, if the test parameters and the scan indicates that everything seemed to be fine, and if the married age is pretty young, then the doctor would advise, yeah, you can go ahead, take a break and plan it, and then a year or two, then you start looking in for uninterrupted planning for conception. Among couple who have run out of all the options to conceive would have also visited, and it's the same hormonal blood test and some analysis would have been advised for the couple, which is basically the male and female. And there are prominent fertility indicators which is heading towards infertility would have already been identified. So these couple would have subjected to medications or injections, and well, the same lies for both the male as well as the female. Going through them, repeated examinations, or through scan, where you monitor, you narrow down your fertility window, then trying naturally, things do not work. It's high time that you look either to an IUI procedure, which is intrauterine insemination, or an IVF procedure, which were looking into. Let's look into the brief plan about this intrauterine insemination. So, in this, where the planning lady would visit the consultant or the specialist on the second day of the period. So, she would have scanned, would have been identified if there's any growing follicles, and that would be documented. And there can be medications, and she would be called for repeated scan to identify a dominant follicle, and precise time when and where the follicle is going to be ruptured. Sometimes, or not always, there can be a medication that would facilitate a follicle rupturing, and thereby the very by the very next 35th hour, an intrauterine insemination process would have been to take place, for which the husband is entertained. We The setup would collect the sample, wash it, separate the good motile sperms, put it into a concentrated part, and the thus concentrated sperm, which is more potent and motile and has very good healthy parameters, is transferred into the uterine cavity. And assuming before going for these tests that the fallopian tubes are healthy and open. And to do rule out that, a doctor would have already advised a HSG test, which is basically a scan to check whether if there is no fallopian tube blockage. With this as a brief, sometimes pregnancy might not achieve. So, repeated trying would not lead to a fruitful result. And the question is also why. Let's say if there are some biological parameters which is identified, the couple now decides for an IVF journey. So, in an IVF journey, the indicator again starts from a day 2 of a periods, where the couple would come on the second day. Relevant blood test would be done for the female, and scan is also done. If the values of the hormones as well as the scan reports tends to be promising to go ahead for a stimulation, she would be subjected for stimulating injections for a period of let's say a week or two. So which is on an average of 10 to 11 days to at most within 14 days. So the development is closely monitored through blood tests and repeated scans to check whether all the follicles are growing, they do not rupture prematurely, and trying to grow as many follicles as possible. And then there is an egg retrieval procedure. Now, on the day of procedure, the lady would have been advised to come in a particular way. She would have been in fasting, and all that comes in. This is a brief journey. So once she comes and the egg is retrieved, now it is the most important part is in the embryologist's hand, where with the help of the sperm, which is also been given by the husband, the oocytes of the women, which is just harvested, would have undergone a procedure of ICSI, and thereby relevant embryo development takes place for over a span of 3 to 5 days. Now it is all completely into laboratory procedure, and the cell multiplication happens to be in nobody's hands. Around the corner of 3 to 5 days, we would have been meeting with the couple to give them an explanation. Hey, this was your cells, and this was the quality, and this was the outcome. On an average, we see a fruitful result, but in reality, there's a lot of hurdles. So, what can be done to alleviate these hurdles? Is it so simple for every couple to have a dedicated 2 week lifeline to come every day, visit the hospital, go through the drills of medication? Because these medications are timely medications, and the scans are, posted in those appropriate intervals. So we cannot skip any of these. So it has to have a very well deeper understanding. Yes. Now we are getting into the deeper understanding, or let's put the word mindful way, to see how we can achieve a fruitful result. So, what are some of the common problems that we would see in an IVF journey? The plan would have been given by the doctor. The number of days to be visited would have been overall understood by the couple. And just because the hormones are really very good in this cycle and they are all motivated and geared to go ahead. 2 3 days down the injection line, you have a visiting guest, and then you say like, oops, I cannot leave my house in front of the guest will start questioning me. I am not convinced or comfortable in sharing my personal decisions and my health matters to others. Then you think, do I take the injection? Do I tell her I'm going to market and skip out? There's a lot of pressure and tension. And then your life cycle for those 2 weeks, like your heating habits or caretaking habits. Then your family member finds out, why are you so engrossed on yourself? Why don't you come and do other things? And that is why you also get equally irritated. All this says that there is lack of mental planning. Your mindfulness activity is missing in proper planning. So, what the very first thing that needs to be done in charting out the program along with the doctor is when you hear from the doctor stating that we can go ahead. and this is the duration. You sit with your psychologist to understand for this duration what needs to be catered. There is work on both the ends, and to give the relevant support to the treatment seeking couple, there is something that's also expected from the treatment seeking couple to also contribute, like timely visit to the center and timely injections and coming for your treatment, irrespective of what the outcome or whatever the couple undergoes, which is nothing but the execution part. So, without explaining what a mindfulness based program is all about, as of now, we are just looking into mindful way of thinking, which is planning. So, a right planning here is actually missing. So, when you sit and talk about your next, let's say you visit your center on a day two. So, until day 15, your attendance is like, mandatory. It becomes like a regime, and it becomes like, every day almost predominantly the same time, for which you have to travel every day, get yourself injected every day. So there is a mental preparation of accepting that the injections being injections, you will be pricked. So there can be associated pain, there can be associated discomfort, and the anxiety about what happens next. So let's say if you are surrounded with all this, there's a lot of distress energy that accumulates because the answer for tomorrow is never known. However, when there are relevant cross-checking mechanisms, like regular blood test and scan to check the medicines that you're taking, whether it is working or not, what is the output or not, is constantly being monitored. This gives us part-time solution to understand that, hey, I am going in the right direction. Probably I need to walk a little bit further. So the mental planning, very specifically, mindfulness-based mental planning. What would be your first question? Who are the people involved in planning? Obviously, it is your treating doctor, your you as the couple, which is husband and wife. It's not like, okay, since it's the women's matter, the entire understanding, play, work, everything is put on the women's head, and then the men take the back seat. You want what payment to be done? Okay, my presence is just required a couple of times in the hospital, rest is your headache. Cannot be like that. There need to be a lot of physical, emotional, as well as psychological support, which involves in also a proper mental planning. So, as per the treatment regime, which is finalized by your treating specialist, a proper plan can be charted out with the help of the psychologist. Understanding who as couple, which is basically your personality, your lifestyle, as well as your work scenario, or who you are involved with, which is your immediate surrounding. So once a brief plan is arrived, then the micro details would come in to look into what are the things that should be taken care, what is required from the hospital side, and what is expected from the patient side. So when this goes hand in hand, irrespective of what is spoken, what is charted, and what is planned, there is always unwelcomed events in life, unexpected turning points in life. But still, at least communicating with someone to say, hey, I have an urgent meeting in the office, and the meeting is scheduled during my injection time. What can be done, rather than panicking or trying to procrastinate the injection or the meeting? Both is expensive, right? You cannot put a treatment to a toss, neither you can put your job at a jeopardy. So when you sit and come up, you can always have a supporting answer to say, if it is what can be compromised, how else it can be executed, can you still come with your workload, and relevant, taking advantage of the technicalities or the technology, you can still come take the injection without missing your meeting. So a proper planning is here is an in-depth planning, trying to identify the micro details of what needs to be done. Some other hurdles would be lifestyle. Let's say a person is not a regular eater. Like, I had my breakfast, afternoon, if at all I feel hungry, I would like to have a glass of smoothie. And since I tend to sit and work out a lot, I would try to cut my carbohydrates, I cut my fat, I cut this, I cut that. And I'm trying to maintain my minimum health. And at the same time, evening after my work, I go for, let's say, a brisk walk, or a jogging, or I do have a habit of hitting regularly to gym to keep myself fit. Well, if you are getting stimulated, are all these accepted? I don't think so. So we will look into that also. So mindfulness based in mental planning, what would be done in the next 15 days? What would you need to incorporate? And how to go about always place so that your execution is smooth enough, which is one way. The most important part in your IVF journey, as mentioned, is your medications. As the backbone of the entire treatment is those stimulating drugs, and we consciously know that sometimes those drugs might cause nausea, headaches, abdominal bloating, weight gain. On a rare cases, sometimes the medications might not be accepted by the body. And worst case scenarios, what to do? Why is it happening? There are many questions. In a medication part, how can you use mindfulness based and intervention to look into a successful medication journey? The mental planning chart autos, I'm supposed to come every day so that I can have my injections on every time. Okay, I'm mentally prepared. Injections. I will calculate. Okay, per day, 1 to 2 pricks. On my cross checking days, I will have additional pricks for blood test. So you're mentally prepared. I've seen good fruitful results among women who's planning for the stimulation, and they have this lot of anxiety associated with needle pricks. So even like today, there was a communication like, I'm not getting pricked again, right? Because my pricking is done. You said 3 injections and I'm done. It is that serious, but it does work. So the mental preparation here deeply involves what can be done to alleviate the anxiety around it. First, one needs to understand what causes anxiety there. Is it the needle prick? Is it the pain associated with the prick? Or is it the pain that's associated with the medicine that is, passing down through the skin? So one needs to understand deeply what is the fear factor, and you need to get within the matter to understand the thought. Where is the fear associated with what? Is it a prick? Is it the pain? Or is it the discomfort due to the medication? If not, it's something that needs to be accepted. Yes, I have accepted, I will take medications, I have no other options. But how, where, and why does matter. So this is what a mindfulness based intervention gives you, again, a proper mental planning. When it comes to the physiological pain factor, your pricking, which might can cause a skin bruise, or there can be skin discoloration, there can be mild swelling, or the medicine itself would have caused burning sensations or pain when the medicine passes down through the skin. These can all be handled by mindfulness based techniques, which actually helps a person to distract, to deviate from the signals being registered in your mind, to say, oh, this is discomfort. Next time for discomfort, even before it comes, I'm going to close my eyes. So it is avoiding a lot of anxious thoughts that getting unnecessarily created, thereby clouding the person, in making the person not to realize that it was just a small prick, and actually the impact was not that big. So to desensitize the hypersensitivity, one of the ways is we look into the factors that causes the discomfort. So I'm not revealing what techniques we are being using, but as you go ahead, I will be revealing what actually would be a mindfulness based therapy, and what all the therapies we can use here, which would be benefiting for the journey of the IVF. So as of now, we've ruled out the anxiety associated with my medication. Well, that's done. Yes, I'm mentally prepared. I can come, I can take my medications and go. The most important part would be a lifestyle that is coming up for the next 2 weeks. Okay, what would be my lifestyle? I cannot get up at wee hours which I want. I cannot eat what I choose to eat. I cannot skip food or fast, or do anything that can disturb or hamper the medication process, or the quality of the treatment, or the output of the treatment. What are some of the lifestyle factors that would have been advised to such couples? Would be have a active lifestyle, not hyperactive. Do not do anything excessive like lifting weights, or causing a discomfort. Due to medications, there can be lethargy, tiredness, and your body would say like, just drop everything and go sleep. Well, you need to listen to your body. What is happening here? You're bringing down your awareness to your physical body. So when you look into your mindfulness way of intervening in my lifestyle for the next 2 weeks, You're bringing down first a mental plan to say, my next 2 weeks I'm going to do this. I am not going to do this. I can manage this and I can oversee this. So if you are a regular working lady, what is the nature of your work? Obviously, you would have discussed with your psychologist. And if the work seemed to be very tedious, there's always a leave that can be applied to, take a break from the tedious work and take care of your body during your stimulation, to listen to what body signals you. Overnight, there can be bout of tummy pain due to nauseatic or vomiting sensations due to gastrointestinal issues, which is common among stimulating ladies. Over time, there can be suddenly, heaviness that you feel. Oops, I'm feeling all too heavy today. And then you stand on the scale and you see your scale is tipped on with it. I am on this diet. According to this, I'm walking and doing everything. What is causing my weight gain? Um, Obviously, the doctor would have also told you that the medications that would lead for a good growth of the follicles would also add on to your weight. So that is which is actually temporary. So answer and egg pickup is done. The weight considerably comes down. So mindfulness lifestyle here is about how do you manage your next, let's say, 2 weeks or fourth, or it can be until your embryo transfer, and gradually taking to the changes once your beta hcg or your pregnancy turns out to be positive, and then the doctor says, hey, this was a very challenging pregnancy, and now since you're pregnant, be very careful, and you have to do changes accompanying your pregnancy to be the middle pillar of your life, and then the rest all falls as next. Third thing is the most important part, which most of the people oversee, is the nutritional aspect. There is no proper evidence or relative references to say, if you eat this, this is an outcome. Like when a doctor says, you put this injection, this hormone grows. Simple, right? And how do we find out? We would be doing blood tests to find out. In nutrition, it's not like that. Though a lot of research paper says that quality intake, your vitamins, your minerals, and body which requires all this at least a little bit more during the stimulation phase, always led to healthy eggs or oocytes. The quality of the oocytes and the number of oocytes, how is their follicular phase that's going on, is closely associated also with one's eating habits, eating as well as the sleeping habits. So let's say a particular blood test reveals that there is a deficiency with the vitamins or the hemoglobin, the doctor or the specialist would have already identified, hey, all this is less. Probably even before starting a stimulation, let's put you through a course of medication so that all this gets revamped into your blood. But even then, food does matter. The very next seeing or looked into for a body's nourishment is food. So, what is the point of eating food that just satisfies your taste and not doesn't meet the needs for the body? A lot of vegetables, good amount of protein, healthy carbohydrates, and a good amount of water would always see that the nutritional aspect is always met. Since the IVF journey is very subjective, I would say that a mindful intervention of one's own eating style always has played a successful role, which we will also look into coming time, how it can be and how well it can be applied with relevant proofs or research works. So, with all this, we will be looking into now what are the research data that would have impacted. And let's now look. Since for the quite some time, I've been talking about mindfulness. For those with those curious questions of what a mindfulness is all, this is a small brief. It's actually a kind of a meditation where you are being focusing intensely with awareness that you would feel what they are sensing in that moment, and without interpretation or judgment. You might be feeling discomfort in your stomach, but you don't want to take it as discomfort. Probably I have overeaten, so there is a bloating sensation. No, you don't calculate it. If is there a discomfort, please mention it as discomfort. Practicing mindfulness involves, like, a set of methods. Though the methods I will share, the most important methods would be breathing exercises, guided imagery, and processes of how would you relax your physical body as well as your mind, and this in turn actually reduces the stress in a person. You need not need all the time in the world to do your problem solving. You need not sit and waste your time daydreaming, or there are very less, or you can say no negative thinking. There would be no random thoughts, and also makes your experiencing towards your stress to be very less unlikely. The incidences of anxiety and depressions would have been reduced, and it always, this practice always directs you to what sort of thinking that you want, because it always involves awareness and focus. So what would you do? So the benefit of this, since it is involving just your mind to look into the factors, by a lot of clinical trials have been done, and there are a lot of evidences that suppose the effectiveness under stress, under anxiety, under pain, under depression, under insomnia, and under hypertension. So, though the medication is also a part of the journey, along with medication, one's own personal experiences, I do have random thoughts, thoughts that kicks in an anxiety. Sometimes I go depressed. What is the point of doing it? So, people who practice into mindfulness-based activities seldomly say this. The reason why seldomly they say this, either they have arrived at a partial answer, or they would have been completely aware, and they take quality steps that they don't fall into uneventful outcomes. So, what does this action do? The mindfulness technique actually improves attention, it builds focus, it avoids a person from being burnt out. And if you're working, like, just blindly working without thinking, it improves a person's sleep. It has also improved in quite a few research papers on diabetes also. Diabetes would come on how mindfulness based eating habits had intervened, bringing in quality eating habits among diabetic people, and how the diabetes has been elevated down, which I would say you shortly. So, simple ways of practicing. Everybody is busy in a buzzy world today. So, your morning, your wake up call is your alarm, and then your night alarm would be your bedtime. So, when there is a disturbance of this, and then the life plays into so many actions, paying attention would be the very first step. So, first activity that you would do in a mindfulness based technique is paying attention. What has happened? Who are you talking to? Rather than when your colleague comes running, excuse me, sir, can you please address this phone call? Rather than taking the phone call and blinking, who the hell is this person in the phone? Or what am I supposed to talk? And then you realize, I'm so sorry, I'm not the right person to give you the answer. Fruitless action, right? So when you pay attention, if you pause and say, what is it all about? And why did you bring it to me? What is it that I have to address? Bringing in a little attention not only slows down the haphazard process, but it also brings a lot of things into notice to identify mistakes, and then a quality outcome can always take place, saving time. Live in the moment. When you build in awareness, and you like paying attention, which is I've been building in an awareness, like for each and every activity, when you involve yourself, what is this and why is it done? Who is this supposed to be done? What would be the expected outcome? How can it be done? How else can it be done? What would be the targeted goal? Is it reduction of time which is being wasted, or are you looking for a quality output? So, looking into the process, which is like living in the moment, would draw in intentionally quality activities that would lead to a quality outcome. For which, first, two things from the personality side one would look into: accepting oneself. Because there's a lot of judgment that comes. Oh, just because my boss said this is black in color. No, whereas it appears gray in color. No, my boss told me it is black, so I am assuming it as black and going. You have not looked in, paid attention, or you've not given in your view to say this don't seem to be a black. Why don't you give it a thought? And if your boss is like, oh yeah, I misinterpreted it or did tell a wrong answer, let's correct it, to thereby delivering a quality output, for which self-acceptance plays a very important role. There is, as I said, most of the patients would tolerate a lot of pain, a lot of social inabilities, a lot of painful personal life incidences, a lot of mood swings. But when a treatment seeking couple comes in, and when qualitatively, when a health psychologist asks, are you facing any, they say like, no, 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 there's nothing like that. And succumbing within always has an impact biologically too. In certain cases, we have also seen indirectly blood pressure shooting. There's a lot of hormonal fluctuations. Despite giving correct dose of drugs, why the hormone continuously fluctuates? And then when we sit and probe, and then there is a bout of outburst of an emotion coming out, it's better that we start identifying right from the small speck. So accepting oneself is very important. For which, initially, when you have a counseling session with your counselor, an overall brief would have come up that this is, let's say, personality X, and the partner is personality Z. So with this personality, in this way, because the personality is in such a way, an explanation of what would be the treatment, making them understand, making them realize what needs to be paid attention, building in the focus so that they can also move ahead with awareness becomes easy. So the first and foremost thing to focus, or even to build an awareness, one focus is one's own breathing cycle. So all that is required for the first technique is mindful based breathing. So the first technique would be is very simple. Every person, when he gets up in the morning, most of us have the habit of praying. So probably after your prayers, you can watch your breathing. So you close one nostril. I'm not talking about pranayam, I'm not talking about hatha, I'm just talking about simple breathing exercise. If you are already doing pranayam, I would encourage you to do pranayam before waking down or coming out. So when you do mindful breathing, which is you're focused in your breathing, it can also be pranayam, probably add a little bit more focus. You would realize that along with your breath, you are trying to flush out, let's say, your negative thoughts. You sit and take time first to identify what are your negative thoughts, and then you gradually close your eyes, focus on your breath, and you flow along with the breath. So what would be the positive thought? I would like to become pregnant. Let's say my eggs are growing good, and then let's say I'm eating properly. These are all your positive thoughts. The negative thoughts would say, what if there is a miscarriage? What if the eggs don't come out well? What if the embryos are all dead? Now, these are all your negative thoughts. When you do breathing, you inhale, and then you focus on the breath. You identify all these negative thoughts, and you're exhaling out. I do not want all these. When you inhale all the positive thoughts. Now your brain would question, hey, I have asked you three questions. They're all valid fears, right? Because I have a self acceptance about myself, and I have seen it as a fear. So, since these questions are valid, I would go back and either ask my specialist or a psychologist to say, what are the chances, or what if I do not get conceived? What if there is a miscarriage, or is there chances of a miscarriage? Two, what if all my eggs are all bad? What are the chances? What can I do to prevent them? Three, what was the other thought that had come in? What if the follicles don't grow properly? Are there any chances that my follicles won't grow properly? Relevant questions to relevant people for an abrupt or an accurate answer would come up. Not just some answer that would just satisfy your mind, and definitely it's not an abrupt answer from the Google. So this allows you to not only identify a positive thought, but now this positive thought is so hard because you've got a conclusive answer. You are good to go ahead. What happens? You're building in hope and faith to move forward in a journey. The second most important exercise would be mindful based body scan. What is this body scan? Just like that, how I told you to sit and focus on your breathing or your breath, you will be focusing on your body, your outer layer of the body or inner body or whatever it is. Among ladies who are getting stimulated, the moment you close your eyes and you focus on your body, the first sensation will come as the pricking sensation. Oh, yeah, but is it paining? Now it is not paining. Oh, very good. So you appreciate. But repeatedly, getting back to the pain, is something called pain threshold. So your body says, no, today it is paining very badly. Okay, just 2 more days, you're good to go. So what happens? You are revamping your negative thoughts with positive thoughts and sensing what is happening in your body through a body scan. You would understand what your body is trying to signal. All these are one step towards becoming stress free. Focus your attention slowly but deliberately on each part of the body in order from like toe to head or head to toe. But be aware that any sensations, any emotions, or any thoughts associated with each part of the body, just like that, pops up. You pause the work and then you look into that popped thought and try to address it. There's also something very important called sitting meditation, where you sit comfortably with your back straight on a chair with your foot flat on the floor, hands on your lap. You can do this focused breathing and put your focus in the breath. Or I have just finished my breathing, I'm all relaxed, but I need to know what my body is indicating to me. You can put your awareness on the body. So this is what is a sitting meditation is all about. And you now and then, wherever you get distracted, you can bring your attention back using your breathing and your thoughts. There's also called walking meditation, where you find a quiet place which is around like 10 to 20 feet, and you start walking slowly. So as you walk, your body is moving, and try to experience what the walking is giving. You're bringing the awareness of the sensations on standing, those subtle movements, a sensation at the bottom of your feet. What happens when you walk on a grass, or was it on a tile, or was it inside the house? And how is it that you're keeping a balance, and what all comes in, ideally addressing the random thoughts that comes in. So in brief, I have just given a brief exposure on the various structured exercises that mindfulness based techniques are involved with. So anybody can practice, and only important thing is, if there is no self acceptance, there are great chances that one can mislead oneself itself. Let's say the body is indicating one thing, but you're concluding it as other. So, based on a research paper which says that mindfulness based intervention for obesity related eating, literature review definitely here indicates that the not only the obesity but also the diabetes part has come down due to involving mindfulness based interventions in treating obesity related eating behaviors. So, binge eating, emotional eating, external eating, eating out of a mere thought to, or a curiosity to know what is the taste, are various reasons why a person would be triggered or motivated or tempted their emotions to eat. Though the quality outcome was very much indeed, the published paper also says that the cognitive based therapies were also used, applied. What were the outcomes? Some, in certain cases, there was also additionally stress reduction seen. In certain cases, we have they have also seen acceptance based therapies, like, yeah, I do accept, I'm an emotional eater. Now since I've accepted that, whenever my emotions are high, I have a mindful watch on what am I putting inside my mouth. So this has helped me in curbing unnecessary eating. So this was one of the based, where one factor of the therapy, which is acceptance, was inculcated. Mindfulness based behavior therapies were also applied to alter a behavior. Let's say the routine of, I'm going for a morning jog. After jogging, on the way there's a pani puri adda, so I go there and I gallop for golgappas and go home. So what's the point of going for the jogging early morning? It's all gone to the brain. So the behavioral modulation here is first accepting that you choose to go there, and then the second thing is you choose not to go there. So what would you do? You complete your jog, you continue your jog, and you reach your doorstep. So first 2 days, one of my participants found it very difficult. Like, you pass by, jog by your pani puri dabba, and your sensations drool. What was the participant's indicator? He said there was a lot of emotions associated with thoughts that evoked emotions that also his taste buds were intrigued. Since it made him drool, He wanted to avoid that, is what he went. So this particular person overcome the drooling by not stopping in the place, going to the home, and equally, eating something immediately to avoid the drooling. So he broke his emotional behavior. So like that, the self-breaking pattern can be highly individual, for which actually self-acceptance is first thing that needs to be seen. Apart from this, combination of mindful exercises has calmed down the person, and gradually when the person started seeing the benefits of fruitful eating, the outcome had always led to 86 percentage of a better behavior among these peoples. So the research here also, validly dominates to suggest and says that it has given a fruitful result among 86 percentage. Let's see some of the other techniques that can be involved in the quality of in improving one's quality of lifestyle as well as one's health. Health is something that is being prominently seen now among treatment seeking couples. Now, to enhance, they have always used integrated mindfulness and lifestyle program. So what were the essences inculcated? What were the outcome? It would be surprising if I'm not going to say, but to say that a research from 2019 says that whenever the mindfulness-based techniques was used, the after effect was the people had experienced greater happiness. So the happiness scale has increased a lot, and happiness is always associated with healthy hormones, specifically pheromones, and that also has a healthy health benefits. So this is one way to see that mindfulness based therapies inculcated for a healthy lifestyle has led to greater beneficiencies. What are the some of the types that we would see? I would like to reiterate here. One would be this meditation, which is usually you either sit or walk. If I use the word meditation, it is very indeed known that you might not be disturbed by your neighbor or your puppy or your kid. It's your time of 20 to half an hour. You either wish to sit, or you can walk, which is any mindful moment, and you will build in an awareness and focus on your bodily movements or your breathing patterns, and thereby addressing your thoughts and emotions. The first one that everybody would focus on practice is the mindful breathing, which I have told you. Third one is creative visualization. What would be the positive thoughts that you would visualize? You should also start inculcating that. So visualization also helps a person to bring in or adds in a lot of healthy vibes in reducing the efforts in killing the negative thoughts. No, I don't want this. Will it go away? No. What if you substitute with a healthy activity? So that there is a distraction and then you deviate, and the healthy thought is also keeping you engrossed in the new thought. It is so magnetic that your mind doesn't want to focus on the negative aspects. Body scan. As I said, you can sit during your sitting meditation and run your focus all throughout the body and try to look into every aspect or part of the body, see what thoughts and emotions are coming up, and then you address. To do this meditation or exercises, journaling is the most important part. Your thoughts is not something that you will think about it and then you forget. No, it doesn't go that way. So you have to jot down the thoughts. So there will be a lot of writing. Some people say, I don't see like thoughts, I see like images. Please put it down. Now, what was the quality of the image, the structure of the image, the color of the image, the pattern, the texture? And most of the people who all has stress, um, sadness, would say that my images tend to look gloomy. There's not much color. The texture was coarse, and it was not able to. I'm not happy looking at it. So gradually, when a positive image was added, gradually the visualization has helped a person to visualize healthy images, which brought in lot of light, lot of pleasing textures, good colors, and that has always elevated the mood towards happiness. So some practices here that always benefits is mindfulness itself, in looking into which is a focus, your breathing, your concentration, awareness in the body, releasing your stress. again, like breathing in, breathing out, or your walking meditation. What more can this mindfulness bring in? What are the roots in Buddhism? How did this become so famous? All this would be discussed in my next session. Stay tuned, and the session is open for questions. Any questions? Okay, so with that, to know in detail the origin of this mindfulness based intervention, um, what are the in depths of the therapy, and how one person can benefit. We will just talk about the therapy itself, irrespective where you want to apply. I've given a brief about when you apply it in an IVF cycle, how your journey in your major hurdles, like your injection phase, your procedure phase, your implantation phase, your pregnancy phase, can be applied, irrespective of that particular perspective. To know more in depth about this particular therapy itself, the next session would be awaited for that. Thank you for listening.